Welcome to the POCUS series. I am Dr. Gopal Kishan Jalwal, Assistant Professor in Anesthesia Department. Today, I am going to tell you about the FATE, Focus Assessed Transthoracic Echocardiography. FATE is bedside examination of the heart by the point of care ultrasound machine. It is usually performed by the non-cardiologist personnel such as anesthesiologist, intensivist or emergency doctors. Why it is called focus cardiac ultrasound? Because here we are going to focus only on the few things such as chamber dimension, chamber contractility or pericardial effusion and the left ventricular ejection fraction assessment. In the FATE, we look for the four views: subcostal four-chamber view, apical four-chamber view, and parasternal long axis view and parasternal short axis view.
And this is right auricle, this is right atrium, and this is left ventricle, and right ventricle is behind. Right. So in the FATE, we use the phased array probe, and this orientation marker should be kept on the left side of the patients. Let's see. So my orientation marker is on the left side.
And place the probe just below the xiphoid process, facing toward or below the sternum.
So you can see this subcostal four-chamber view. Now I am going to freeze it. This is a subcostal four-chamber view. To obtain the subcostal four-chamber view, patient should be in a supine position and legs should be flexed. The advantage of the subcostal four-chamber view is that we need not to place the patient into the left lateral side, and that is very helpful, especially in the patient those are on ventilator or trauma patient or during the cardiac arrest. Here you can see this is a left ventricle, this is the right ventricle, left atrium, right atrium, and interventricular septum, and this is a pericardium. So in this view we can assess the left ventricular or right ventricle function, can evaluate the chamber dimension or wall thickness, and this view also provide a quick assessment of the pericardial effusion in the cardiac tamponade, or you can assess the RA-RV dilatation in the pulmonary embolism. And if you rotate the probe 90-degree counterclockwise, you can also assess the IVC. To obtain the apical four-chamber view, patient should be placed in left lateral or supine position, and you have to place your probe just below the nipple at the apex. And what you will see, this is a apical four-chamber view. So this apical four-chamber view provides a clear view of the all four chambers and the septum, and this view is ideal to assess the contractile function and study of the heart walls and the other aspect of the heart. This view is also very helpful for the quantitative and qualitative assessment of the left ventricular ejection fraction, and here in this view you can see this is a left ventricle and right ventricle, right atrium and left atrium, and this is the interventricular septum, this is the interatrium septum, and here you can see the mitral wall. This is the anterior leaflet and this is a posterior leaflet, and this is a tricuspid wall, and this is a pericardium.
In the parasternal long axis view, you have to keep the orientation marker toward the right shoulder and place this phased array probe into third or fourth intercostal space, left side of the sternum. And what you will see that parasternal long axis view, and
you can get the parasternal long axis view either into the left lateral position or in a supine patient. This view is very important considering the assessment of the left ventricular ejection fraction and measurement of the left ventricle outflow tract diameter.
this is a left ventricle and this is a right ventricle, and here this is a left atrium. It is a mitral wall. This is the anterior mitral wall leaflet, posterior mitral wall leaflet. This is the interventricular septum, and here you can see this is a aortic wall outlet. Okay, and this is a pericardium. For the parasternal short axis view, you have to keep this phased array probe into third or fourth intercostal space on the left side of the sternum, and this orientation marker should toward the left shoulder.
So parasternal short axis view provides the view of the cross section of the heart, and it is very helpful for the assessment of the left ventricle contractility or regional Wassermann abnormalities. And here you can see this is a left ventricle, and this is a anterior mitral wall leaflet, posterior mitral wall leaflet, and just above the left ventricle here this is a right ventricle. In this view you can only see the two chamber, right ventricle and left ventricle, and this is a pericardium.
So the ejection fraction assessment that can be done either by the quantitative method or qualitative method.
Left ventricular ejection fraction assessment by the eyeballing method is the most common used method in day-to-day practice. In this method, we look for the two things. First one is the left ventricular wall contractility, and the second one is the approximation of the interventricular septum and anterior mitral wall leaflet. First you have to get the apical four chamber view, and then you have to look for the left ventricular contractility, and second thing you have to see the anterior mitral wall leaflet approximation with the interventricular septum. Here you can see the anterior mitral wall leaflet is touching the interventricular septum. So on the basis of these two findings, we can say that in this patient, left ventricular ejection fraction is in normal range. So the first quantitative method of left ventricular ejection fraction assessment is that first we have to calculate the E-point septal separation, and then findings can be apply into this formula, and we can find out the left ventricular ejection fraction of the patient.
For the ejection fraction, first we have to see the parasternal long axis view. Okay, once you will get parasternal long axis view, then you have to apply the M mode here over the metal wall. And then freeze it. Okay, so this is a M wave, and we have to calculate the distance between the interventricular septum and M wave. If it is less than 8 mm, then it means ejection fraction is normal. Let's see what is the distance. This is called E point septal separation. So it is around 0.76 centimeter. So means around 7 mm. So in this patient, we can see that ejection fraction is normal.
So the another quantitative method to calculate the ejection fraction is we have to find out the fraction shortening, and this is a formula for the fraction shortening. In this we have to calculate the left ventricular diastolic diameter or left ventricular systolic diameter, and then we have to calculate the fraction shortening. So the 28% fraction shortening or more than that is considered equivalent to the normal ejection fraction, and less than that considered is a low ejection fraction.
We are going to calculate the left ejection fraction through the fraction shortening. First, we have to get the parasternal long axis view. So this is a parasternal long axis view. Now you have to apply the M mode, avoiding the metal wall, and place the M mode and then freeze it. Okay, now I am going to calculate the ejection fraction. So first I am going to check the left ventricular diastolic diameter. So this is a left ventricular diastolic diameter. Okay, now just save it. Okay, and now check the left ventricular systolic diameter. Just save it, and now you can see this machine has automatically calculated the ejection fraction through the fraction shortening. In this patient, fraction shortening is 33% and ejection fraction is 61%.
So the assessment of ejection fraction by the Simpson method is considered most accurate, and in this we have to calculate the end diastolic volume and end systolic volume, and then these findings can be applied in this formula and can calculate the ejection fraction.
So for the Simpson method, first you have to get the apical 4-chamber view.
Okay, so now we will calculate the left ventricular and diastolic volume and left ventricular and systolic volume, and then we can calculate the ejection fraction. So the left ventricle and diastolic volume is 111.8 ml. Okay. Now we will calculate the left ventricular and systolic volume. That is around 31.4 ml. So we can calculate the ejection fraction with a formula. So you can see that this machine automatically calculate the ejection fraction, that is 72%.
So I have captured few abnormal findings while performing the FATE in our institute, and I am sharing in this video.